In a two-point gait pattern, one crutch and the contralateral leg move forward and simultaneously make contact with the floor. The other leg is advanced beyond position of the crutch as a step-through gait pattern. This technique is used for a patient who demonstrates enough stability and mobility towards a natural gait pattern. The three-point gait pattern is used primarily for patients with a non-weight-bearing restriction. Both crutches and the affected lower limb advance together then stabilize. The weight-bearing limb remains in contact with the floor behind the crutches, confirming the three-point pattern. It then swings through both crutches. Patients normally begin with a step-2 gait pattern but are instructed and will progress to a step-through gait pattern. The four-point gait pattern is characterized as a slower walking speed using two assistive devices. The patient starts in an upright standing position. The right crutch is advanced forward, followed by the left foot. Then the left crutch is advanced, followed by the right foot. This technique provides maximum stability due to the continuous 3 points of contact on the floor while the swinging foot is moving. Therapists would prescribe this technique with patients who display muscle weakness and balance bilaterally.
A swing-2 gait pattern is used when the patient has limited use of both lower extremities and/or trunk instability. This gait pattern requires the patient to have considerable amount of arm and upper body strength to support the entire body weight. The swing-2 gait pattern is usually performed with two crutches. The patient needs to bear weight on the unaffected leg, and then both crutches are advanced forward together at the same time. The patient should shift his or her weight forward while swinging the body to the position even with the crutches. The therapist will need to stand posterior and slightly to the side of the affected extremity. The therapist should also keep one arm at the level of the patient's center of mass and the other arm on the contralateral shoulder in order to direct the trunk when needed. A swing-through gait pattern is used when the patient has limited use of both lower extremities and/or trunk instability. This pattern is the fastest of all crutch gait patterns, therefore it is not as safe. The swing-through gait pattern is different from the swing-2 gait pattern only in that the body lands past the crutches with every step. To complete this gait pattern, both crutches are advanced forward at the same time, and the patient should shift his or her body weight onto their hands for support. Lift the leg and swing forward beyond the point of the crutch placement. The therapist will guard the patient similar to the step-2 gait pattern, trying not to impede forward progression.
The tripod alternating gait is typically used when a patient has a deficit which prevents the lower extremities from supporting or advancing the torso. Forearm crutches are typically the best assistive device since they allow the maximum maneuverability. The patient must have a well-developed upper body and core in order to successfully operate the forearm crutch. This technique is taught prior to attempting the tripod simultaneous technique. The patient first advances one crutch and then the other, followed by simultaneous advancement of the lower extremities. The trunk drags the lower extremities from the initial resting position to the final position of the advanced assistive device. Smaller steps are initially taken to facilitate a safe technique. While guarding the patient, the clinician should keep a broad base of support and be positioned in the posterior lateral position. A gait belt should be used to help advance movement or prevent falls.
Hi, my name is Lisa, and I'm a physical therapist here at the Nebraska Medical Center, and I'm here today to show you some basic tips for how to use crutches correctly. If you have not used crutches before, the first thing that you want to remember is they need to be fit properly for you. So I'm going to go through a couple of basics for that. The first thing that you can check on your crutches to see if there's a tool that will help you decide your height and where they should be at. This is kind of a reference only. So you want to get the whole set to where your height is as a general reference point. And then you're going to turn the crutches right side up. And when you stand nice and tall with the crutches at your side, when you hang your arms at your side, the wrist part should line up about with your wrist. So your pad and your wrist are even, and if you put your hands on the pad, your elbow has a slight bend in it. The other thing to remember is that you should have a little bit of a gap between your armpit and the top of the crutch so that there's some space there. The first thing you want to remember if you're using crutches is not to lean your armpits onto the top of the pads, because you can cause nerve damage that will affect the sensation and the strength in your arms. So that when you put your hands on the crutches, you do have a slight bend in your elbow and a slight gap underneath your armpits of about 2 finger widths. You're going to put your affected extremity or leg forward. Both crutches will be on the side of the injured leg. You're going to push up from the hand grips with one hand and the chair or the bed with the opposite hand. So you're going to lean forward, push up with both arms. Once you have your balance, you bring one crutch around to the opposite side and place both crutches beneath your armpits. And you can see that I am using the surface behind me, the chair, a little bit just to get some balance when I'm transferring one crutch from one side to the other. When you go from a standing position to a seated position, whether that be a chair or a bed behind you, you want to back all the way up to the surface with your crutches until you feel the chair or the bed behind your unaffected leg. Then you're going to bring the crutch around from your unaffected side to your injured side. Bring the crutches out from underneath your armpits. Reach down for the hand grips. With the opposite hand, you're going to reach down for the chair or the bed. If you have a chair rest, it will be easier to reach for that. You kick the affected foot forward and you have a seat, nice and controlled. What you don't want to do is just look back to see if it's there. Bring your crutches forward and have a seat like this. Once your crutches are fit correctly and you're standing up, you're going to bring one crutch around to the other side and stand up tall. Your doctor will let you know how much weight you can put through your leg. For this video, I'm demonstrating not putting any weight through my injured leg. You're going to bring your crutches forward first, swing the affected or injured leg forward first, and then take a small step with your good leg. Crutches forward, step. As you get better, you can start to take longer steps. To ascend and descend stairs, take steps until you're as close to the staircase as you can be. If you have a railing, you want to use the railing if it's available. The first thing you're going to do is take one of the crutches out from the side that you're using the railing on. Place both crutches underneath the opposite side. Reach for the hand railing, and you step up with your good leg. So you're going to put weight through both hands, step up with your left foot, and then you bring your crutches up. And my injured leg is hanging behind me. You're going to push through your hands and step up again. Once you're at the top of the staircase, bring one crutch around again and continue walking. To descend the stairs, you're going to bring your crutches around to the opposite side as the railing that you're using and take a hold of the handrail with the other hand. To go down, you go down with your crutches first, then your injured leg comes forward and you put the weight through your hands to step with your left foot. One step at a time. So always remember to follow your doctor's orders as far as how much weight you can put through your injured leg. But a few key things to remember when using crutches will help you heal and get home safely. Remember not to lean your armpits onto the top of the crutches. Remember to always stand tall. And you're going to move your crutches forward before you step with your uninjured side.